I'm Naya. I live in Eagan, Minnesota. I live in a shelter currently called Dakota Woodlands. People come in like scared to talk about health, and some people scared to just express even. People do need these resources. They need to know that it's out there, that it's available, that it's free to get. That's the main thing. It's free, it's no cost. You know, kids getting sick, it's flu time. It's like, you need someone on hand, like, okay, we can do this. Yep, sometimes that take a toll on people.
Vanya Howard, CHW consultant, doula, and subject matter expert. Community health workers connect individuals with things like funding for adjustments in the home, grab bars, wheelchair ramps, anything that would allow an individual to have a better quality of life if they're able to stay in their home. Community health workers support nurses by providing health education and working with individuals so that they're able to self-manage their illnesses.
Leah Roberts, Public Health Supervisor at Dakota County Public Health. Our populations that we serve include pregnant women, young families, the elderly, as well as anyone else who might need our services in the community at large. CHWs have a huge impact in our community. They are often members of the communities that they're serving, so that helps garner trust and help bridge a gap between county services and the community. They're able to meet individuals where they're at in order to give them more health literacy, as well as empower them to take control of their own health and access resources that are available to them. Our CHWs work across almost every team in our department. So from family home visiting, they work with the nurses to home visit to individual clients and address different social determinants of health, healthcare access, resource needs, as well as education. Our community health workers are car seat technicians, and they can provide car seat education and actually bring out car seats to families who qualify. We also work with our aging initiative through a falls prevention program with our fire department. So if there's frequent fallers in the elder population, they will get a phone call if they agree to ask questions about the state of their home, resources they have in place, and we can send out information to them to make them more safe in their home. They also work with our refugee population. We have a refugee health program here, and every new refugee will get a public health nurse and a community health worker in order to address needs such as how to navigate our medical system, how to use medical transportation, and other resources they might need. We also can help with direct observed therapy for tuberculosis patients, as well as other resources through our community outreach. We work with the Child and Teen Checkups program to make calls to new enrollees onto medical assistance, ensuring that families have access to a medical provider, as well as are aware of all the benefits that come with their medical plan.
My name is Shandy Potis-Mangra. I am the CHW Workforce Development Program Manager for the Minnesota Community Health Worker Alliance. The Minnesota Community Health Worker Alliance is a statewide nonprofit supporting the profession of community health workers through professional development, convening of peer support groups, as well as providing resources to allied professionals. An environmental scan that came out in 2024 found that there are over 1,300 CHWs that have received their community health worker certificate from higher ed. 47 of 87 counties in Minnesota currently have CHWs employed. That's about 54% of the state. There are over 880 CHWs currently working in the state of Minnesota across various workplace settings that include behavioral health, long-term care, public health, community-based organizations, and many, many more. There are workforce shortages throughout Minnesota when it comes to our healthcare system and in social services, and we know community health workers are essentially a profession that can help fill those gaps and really meet those needs of the community. And we need employers and for funders to understand that this is essential work that we can't do alone. The Minnesota Community Health Worker Alliance is very much a convener and a support for strengthening the healthcare and social service systems by employing and building the capacity of community health workers.
Thank you, thank everybody, and thank you all for all that you do.